How Taiwan created its healthcare system. I live in Taiwan but grew up in America. A few years ago, I severely sprained my ankle playing basketball. While rolling about on the ground in pain, some of my friends suggested that I should go to the hospital. Like any sensible US citizen without employer health insurance and with nightmares of $25,000 emergency room bills in my mind, I freaked out and told them never to take me there. Later, it was told to me that such a thing would only cost about $35. I still don't believe it is true. Recently, a New York Times article came out about the leap to single payer, which focuses on Taiwan's medical system, comparing it favorably with that being implemented in the United States. I especially enjoyed reading the threads on the Hacker News thread, the comments on the Hacker News threads. Many comments praised the quality and affordability of the care they received in Taiwan, despite not being a citizen. Some other comments note a few caveats, making comparisons between Taiwanese and US healthcare system. And I especially like this one, which is sort of true, though a bit condescending, it feels almost proud of America's terrible diet. At the time this came out, I'd already been working on this video, and I figured now that the article was out, it was time to accelerate. So here, I'm going to look at the evolution of Taiwan's healthcare system and point out a few things that I noticed about how they created it that I think might be relevant. I do want to say that I thought it was a pretty good article, no criticizing it whatsoever. First, a few things about Taiwan. As the NYT article notes, there are 23 million people living on the small island, and over 99.9% of them are insured. The NHI, or National Health Insurance, is Taiwan's single-payer healthcare system, first implemented in 1995 after nearly a decade of planning. It is funded by the government, employees, and employers. The insured contribute 40%, employers 29%, and the government the rest. It provides preventive and medical services, prescription drugs, dental services, Chinese medicine, and home nurse visits. It's a market-driven system where both patients and providers have free choice. Hospitals and physicians are paid on a fee-for-service basis. It is one of the most popular social service programs in Taiwan, but at its time, its creation was much in doubt at the bill's passing. Let's talk some history. There are some stages in Taiwan's history, and the healthcare system reflects those stages. Before the Japanese colonized Taiwan at the start of the 1900s, most of the healthcare was mostly centered on traditional Chinese medicine. The first Western doctor did not even begin practice until 1865. But once the Japanese took over, they scaled down the Chinese traditional medicine and scaled up training of Western medicine. They implemented the first Western medical schools and created a licensing system to guarantee healthcare quality control. In 1950, the island again changed hands. Chiang Kai-Shek and his nationalist forces had lost the Chinese Civil War and fled there, establishing a single-party state, sort of like what was happening on the Chinese mainland. Taiwan was now ruled by a single party, the Kuomintang. From 1950 to 1971, the Kuomintang did not do much notable reform or expansion of the healthcare system other than setting up various veterans and public hospitals across the country, along with some mass vaccination drives. In 1971, however, reforms vastly accelerated. The Department of Health was placed under the overview of the Executive Yuan, which is sort of like the executive branch of the United States. During the 1970s afterwards, the DOH took steps towards growing the number of physicians practicing in and across the country, making sure that their geographical distribution was even. This was done through a mix of market intervention and smart incentives. For example, to fill immediate leads, the DOH recertified many retired medical doctors out of the military and expanded the supply of medical schools to meet future needs. They also encouraged private industry to start more hospitals of their own, including the Chiang Memorial Hospital in 1976, which now operates more than 9,000 beds in 5 different geographical locations and has become the largest hospital chain in Taiwan. This gradually reduced the share of public hospitals in the country. Throughout 1985, the government continued to focus on expanding physician supply and cutting the costs of treatment, creating a fund to encourage more private hospitals to open, passing legislation to prevent an overconcentration of private hospitals in urban areas, and so on. The centerpiece was a declaration by Premier Yu Kuo-hua in 1986 after 2 years of study that they would move to a single-payer system by 2000, the NHI. It is now that we should mention that at this time, Taiwan was undergoing a transition to democracy, with the ruling Kuomintang party coming under increasing pressure from its opposition party, now the DPP. Under this pressure, the 2000 launch date was moved up 5 years. I will talk more about this later. Before the introduction of the NHI in 1995, the Taiwan's government had four major social insurance programs, closely modeled on Germany and Japan. The systems were for labor, government employees, farmers, and low-income households. The NHI subsumes the labor, government, and farmers' insurance systems into one and expands it to everyone else. It was a dramatic change. The implementation was made for political cover, so there was the potential for chaos in 1995. But some steps were taken to address these issues. First, it was set up so that 57% of the population who were previously insured were already familiar with the NHI. A preparatory office was created 2 years beforehand, in 1993, with the subsidized premium contribution rates, and hotlines were set up for extensive face-to-face consumer feedback. As a result, the public satisfaction improved, and over time, it became the pride it is today. Let's talk some budgetary issues. The NHI was implemented during a time of greatly expanded wealth. The GDP was growing 6 to 8% a year at the time. This allowed the government to handle NHI without having to impose great amounts of taxes or having to cut back on current social services. The article notes that Taiwan has an aging population with smaller tax bases to contribute to premiums. Older people generally require more healthcare, and combined with a slower economy, created budgetary issues with the NHI. A few years after the NHI was established, the program began to run into budget constraints, and several proposals were announced to try to fix them. In 1997, the Kuomintang tried to split up the single-payer system to set up multiple carriers, but this was cast in the media as privatization, and they had to backtrack on that. By this point, it was clear that the party no longer had the power to single-handedly drive reform like it had before. The NHI budget crisis thus continued on. When the DPP took power in 2000, they started a research panel to look at what was needed to be done. But before the panel could present their findings, then started the NHI double jeopardy incident, where the NHI had to raise the percentage of contributions and co-payments due to the fact that the fund had shrunk to the point where it had less than 1 month savings left. As the article notes, though, an overdue premium rate increase in 2010 created surpluses that are expected to last into 2017. Today, the NHI controls its budgets chiefly with a global cap system with fees negotiated between representatives from physicians, hospitals, providers, government, and academia. A lot more things are done as well, but we can put that into another video. Politics. Let's go back to the politics. The path of the NHI began as Taiwan democratized from Chiang Kai-Shek's dictatorship to a more soft form of authoritarianism under his son, Chiang. I think something that the article does not mention, and for good reason, is that it took 8 years of planning and intense political debate between Taiwan's version of Congress and the presidency to end up passing the NHI bill. Then crucially after that, it took 2 more years. It took years more of tuning to get to what it was today. The original bill caused the NHI to drop into deficits when it first came out of gate. It needed more tuning. The Kuomintang proposed and worked on the NHI because of the political pressure it was feeling from opposition forces and the general populace. From the 1950s and the 1970s, the party state had been focused on retaking the homeland. But after setbacks in the UN and international relations, it became clear that the Kuomintang needed to focus on its people. Chiang thus began reforms to include more Taiwan-born politicians in the Kuomintang, and their influence began the political will to create the NHI. The final NHI bill was pushed through despite vociferous pushback from the bureaucratic system, as would consolidate the 3 insurance systems, and many of the workers would lose their jobs. But the Kuomintang pushed it through anyway because the party was feeling intense pressure from the DPP, whose focus was on the social welfare of the native Taiwanese people, and an impending presidential election, the first in history, was coming in January 1996. That year, the Kuomintang held its legislative majority by the slimmest of threads, and the bill sat in gridlock for 3 months as the 2 wings debated as to who would pay for the NHI. The political environment that created the NHI depended on a party that still held power, but felt a healthy opposition nipping at its heels. It depended on a variety of stakeholders working together towards a single system, and it depended on a people who was willing to vote for and flip for a party that would help govern by implementing policies that improve their lives.